the top line was businesses mandating over 100 people, which is obviously controversial. I think, to me, it's just mind-boggling that healthcare workers, as soon as there was a vaccine, were not mandated to get it. That's kind of obvious. But I'll start with Walker because you, maybe more than me, have kind of been on the mandate train from a federal perspective. Is this enough? Is this too much? Why? What are your initial thoughts?
Well, my initial thought would be to reach out and ask Justin what he felt about the
All right,
about the plan. But speaking just personally, I am glad to see Biden wielding federal power. Probably for the first time during this pandemic, federal power is actually getting used to do something about the crisis. This is a the public health crisis, international. We've lost minimum 650,000 Americans, and I think, and Justin, I think that you might have something to say about this. That number is probably an undercount. So I think that it's good that we're finally seeing things like paid time off. And this isn't necessarily just a vaccine mandate. It's vaccines or weekly testing. And so, everybody can just kind of calm down a little bit.
Well, I'll also, Justin, you might also recognize this. It's very interesting that he could take such forceful action and enlist OSHA and other things. But when a parliamentarian speaks on the $15 minimum wage, he's in fetal position. So I just want to point that out, that he could actually take action for certain things, but if it's for, raising wages or healthcare, he's pretty much paralyzed. But anyway, Justin, your thoughts on, let's focus on the business mandate.
Yeah, so there's, I'll give a little background here because it basically got almost no media coverage, although I think Walker did write a story about this. Biden came into office with some plans about doing something about the pandemic, let's say. And he didn't really try to do those things. He didn't try very hard. And part of that was an occupational health regulation that OSHA drafted and released a few months ago. It may have been April or May. I don't remember at this point. And basically, Biden decided not to go through with it. And he didn't do lots of other things. He didn't hire the 100,000 public health workers. He didn't create guidelines for when to shut different kinds of institutions down and people to stay home. And he didn't scale up testing, really. He kind of figured that, okay, there's vaccines now. This thing's kind of going to trickle off on its own, going to go down to manageable levels. And then Delta happened, and we were caught unprepared. And some of the things that need to happen now are going to take more time than we have. We're at a crisis point in the US. 1,500 people are dying of COVID a day. That number keeps increasing every day. And those deaths are people who got infected 3 or 4 weeks ago. And since then, the caseload has increased by 4-fold. So it's possible that in a month from now, we could be at 4,000 or 5,000 deaths a week. 4,000 or 5,000 deaths a day. Just astounding levels of death.
And by the way, Justin, not to interrupt you, but we haven't even gotten to the fact that there's a new variant spreading called the MU. I don't know how to pronounce it.
I think.
So we can get into that later. But there is a new variant as well.
Yeah. So Biden decided, because of this crisis with Delta, that he did need to take some action. But we're not, because he spent the last several months doing very little. We're not at a very good place. So the OSHA regulation is something. Again, the details aren't entirely clear. What we do know is you can choose to be vaccinated or tested if you work for a company of 100 or more employees. That's going to leave out people who work for state governments, including public schools. It's going to leave out about 50 million private sector workers who work for smaller businesses smaller than 100. And that's a lot of people being left out. I can go into what I think are the ethics of mandating vaccination, but I don't know what direction you want to take this in.
Well,
Yeah.
can I just ask a quick question? Do you think, I mean, you mentioned earlier that vaccines alone are probably not going to end this pandemic. I mean, can you elaborate on that, I guess, is what I wanted to ask. Can you just elaborate as to why we should do more?
Yeah. So if we do what we're currently doing in the US, which is not very much, what happens is you have people build up immunity through vaccination and or through infection. A lot of people are building up immunity through infection. When that happens, a lot of them are going to be hospitalized, causing the healthcare system to collapse, which we're basically seeing in many places. A lot of them are going to die. So we can continue to do very little, but it has a tremendous cost. And then there are other ways of dealing with this through a combination of vaccination and what we call non-pharmaceutical intervention or public health measures. That's everything from universal testing at institutions, masking, quarantine and isolation, paying people to stay home when levels are really high. I don't think we should have indoor dining right now. I think that's a pretty bad idea, especially unvaccinated indoor dining. These are all policy decisions, and they're being made in favor of business and at the expense of working class, and especially working class people of color who are just dying at incredibly high rates. So we need to do better. No one measure is perfect. We need to layer many different measures together.
And Justin, you mentioned indoor dining.
Yeah.
I know the data shows outdoor the spread is much less likely, but when I see 50 to 100,000 maskless people packed next to each other at sporting events, I don't want, no fans in stadiums, but at the same time, I don't know. I remember Florida spring break last year. Sure, there was no vaccine, but cases went through the roof because, younger people were swarming beaches in Florida. I did it. There was no vaccine going on when I did it. So I agree with the indoor restaurants, but I don't know. It's just kind of been accepted. Are you ready for some football? And nobody's really talking about, holy shit, how many people are vaccinated there, and does it even matter?
Yeah. So outdoors compared to the identical situation indoors is much safer. But I would absolutely, if you're going to be outdoors in large groups, it should be masked and or distanced. If you're 6 feet away from someone outdoors, you're pretty safe. We're really only concerned about droplet transmission. So if you're really close to a pack of people, like at a concert or a sporting event, people are talking, you do have droplets coming around, that can be a bit unsafe.
And can I also ask you, because you were going through the things Biden could have done or said he was going to do and didn't, but there's one thing I keep hearing him saying. I think it's for business. I also think it's for 2022. He just keeps emphatically saying there will be no more lockdowns. There will be no more shutdowns. We're not shutting down schools, which is a pretty firm position to put yourself in if deaths are going up, cases are going up. And frankly, Biden and others criticized Trump, rightly so, for not shutting things down sooner. Mm-hmm. So it seems to me like I don't want lockdowns, but at the same time, I don't want this to last for the next 5 to 10 years either. Yeah. So isn't he kind of wrongly kind of just ruling things out that might be necessary?
Yeah, so this is a major problem. So you need infrastructure in place to do a shutdown. That includes paying people to stay home, paying businesses to stay afloat in the meantime. So, and these are policies that did exist in the US. We used them too little and too late, so they didn't have full effect. But you can think about places like New York City or San Francisco that had several week-long shutdowns. And we had a program, pandemic unemployment assistance, that at best, at the earliest point, and this was Trump's idea or someone in his administration's idea, pay people unemployment plus $600 a week. this actually brought most workers who were furloughed, brought their income higher than when they were on the job. And it also didn't count towards Medicaid. So usually these workers who are furloughed have Medicaid. They might not even have had in medical insurance before. So in some ways it improved their situation, but it ended. It started back up again, and it ended again. Biden didn't continue the pandemic unemployment assistance policy, and we just have this perfect storm of PUA ending, eviction moratorium ending, people going back to school, people going back to work, weather getting colder, all at the same time. This is not, this is not good. I know the South is where things are getting really bad right now, but things are ticking up in the West, in the Northeast, and I hope it doesn't happen, but I do think the changing patterns of social distancing are putting us in a bad place where we're likely to see many more hospitalizations and deaths in lots of the rest of the country, even though we have higher vaccination rates in those parts of the country.